Welcome to Lunch with Legacy Leaders, a weekly talk show with local and national thought leaders on issues impacting the Black community. Now introducing our host, Miss Anne Marie Sorrell.
Good afternoon and welcome to another episode of Lunch with Legacy Leaders. I'm your host, Anne Marie Sorrell, President and CEO of the Mosaic Group. I'd like to thank you for taking time out of your busy schedule to join us this afternoon. Before we get started, I'd like to thank our sponsors for making this broadcast possible. I'd like to thank Broward Health, AARP, the Solid Waste Authority of Palm Beach County, and the African American Black Alzheimer's Disease Initiative at the John P. Husband Institute for Human Genomics, University of Miami, Miller School of Medicine. If you or someone you know is experiencing loss of memory or memory problems, please contact their research team for more information at 877-686-6444. Today, I am joined by several experts. Dr. Yvonne Johnson, who's the Chief Medical Officer at Baptist South, Dr. Gail Biggs, Chief Nursing Officer at Jackson Health, and Dr. Todra Anderson-Rhodes, Chief Medical Officer at Memorial Hospital, Miramar. Thank you so much, ladies, for joining me this afternoon.
Thanks for having us.
Thank you.
Thank you. So we have, in lieu of time, because we have so much to discuss, and I want to be able to hear from each of you, if you could just briefly tell us, our audience, what your specific roles and responsibilities are at your respective healthcare institutions. So we'll start with Dr. Johnson.
Hi, good afternoon, and thank you for having us. I'm the Chief Medical Officer at South Miami Hospital. I touch pretty much all of the areas that involve the medical staff and patient safety. So I'm all over the hospital dealing with medical issues.
Awesome, thank you. Dr. Anderson-Rhodes?
Good afternoon again. So I am the Chief Medical Officer at Memorial Hospital Miramar in the Memorial Healthcare System. And I, like Dr. Johnson, deal with everything and all things related to the medical staff, which is our physicians, but also in the operations areas, anything that touches the patient really that could be touched by a physician, we're in there. So we're definitely there in the trenches, and really happy to be here with you and in this broadcast.
Awesome. Thank you so much for joining us. And Dr. Biggs. Dr. Biggs, can you hear us okay? Okay, well, Dr. Biggs may be having some technical difficulties, so we will come back to Dr. Biggs. So today we are talking about, and I know everybody's wondering why so much is happening around COVID-19. So, our country appears to be on track to recovering from COVID with, the vaccines coming online late last year, earlier this year. But in your professional opinion, what has happened that we now have a surge in cases, hospitalizations, deaths are on the rise again, and specifically with what's happening here in Florida, where we have become, again, the epicenter of this pandemic. So, Dr. Johnson, would you like to start?
Sure. So what we've learned is that, viruses have a tendency to mutate. It is within the nature of a virus to try to change its physical and biological structure to try to be able to attack us more efficiently. And that's what a mutation is. And so this virus is mutated in many different ways. This Delta variant is a mutation that has allowed the virus to become much more infectious than it was before. And in fact, it can even infect people who have been vaccinated. But what we know about the vaccination is that it prevents you from getting seriously ill and dying from this variant. So it's still really very important that we get vaccinated. The more that we get vaccinated as a community, the less the virus has the opportunity to make those mutations. It has to spread from person to person in order to be in an environment to mutate. So if as a community, we have a significant number of people who are vaccinated, we'll be able to slow that process of the virus mutating and becoming a more perfect virus to infect us.
Now, before we go to Dr. Anderson-Rhodes, just to piggyback on your question, I'm just from a logical standpoint, if the virus mutates from person to person, do we have and because the Delta variant is also infecting those who have been vaccinated in high numbers as well, is there a possibility that there could be another type of mutation from that person to person with those who are also vaccinated?
Well, we know that there are more than this mutation. So there are a variety of mutations that are out there, and some are more effective at infecting us than others. The Delta has been one that's been very efficient in being able to infect us. So we can reduce those mutations the more the people are vaccinated. So we just didn't have enough people vaccinated to prevent, the mutations. But the important thing is, despite the mutations, the vaccine is preventing death. So a lot of people are saying, well, why do I get vaccinated if people who who've been vaccinated are getting the virus? The reason is the people who are getting vaccinated aren't dying. And I think not dying is a really good reason to get vaccinated.
Wow, thank you, Dr. Johnson. Dr. Anderson-Rhodes.
Absolutely. I concur with everything that Dr. Johnson said. I would also add that in addition to us not really having enough people vaccinated, we also had those who then dropped their guard during that same time. So it set us up for an unfortunate perfect storm because we had gotten down to lower levels of infectivity and positivity rates at the end of May and during June, right when the summertime was coming along. People started going out more, congregating more because there was this false sense of security almost. And so you add the variant on top of that with people now coming back together into groups and sometimes crowded groups or concerts or outings. And it just led to this perfect storm. As Dr. Johnson mentioned, the Delta variant particularly is about 1,000 times we now know more infectious than what we've seen with the original coronavirus infection, or even some of the alpha variants and others that have we've seen. That's like the chickenpox. If everybody has heard stories of family is telling stories, one person gets and then everybody in the household gets it. That's what this type of mutation has now been able to do, even in areas where people may have been even a little bit further distanced. So when you add those things up, we now have what we have now. And also remember too, that some of the masking mandates did go away. And we unfortunately know that not everyone who was not wearing a mask, let's say in Publix or Winn-Dixie or any other chain, probably not all of them had been vaccinated either. And so that's why we as healthcare providers really try to stress that people be very cautious. We're optimistic at times, but really to be cautious and be mindful of your surroundings. And so I tell people all the time, when I go to Walmart or wherever I am, I look at people, if they get a little too close and I am fully vaccinated, I still request that they would stand back a little bit and give me some space. And so there's some things that, we can still do outside of vaccination, although I agree vaccination is the best way to stem this and also to stem future variants, but also just maintaining our physical distance, remembering to wash our hands like we were talking about before, and definitely wearing our masks, especially in public.
Absolutely. Let me see if we can get Dr. Biggs on again. Let's see if we have her. Dr. Biggs, can you hear us? Dr. Biggs, can you hear us? I think she might be having some challenges hearing us.
Muted.
If you can hear us, unmute yourself. Okay, so maybe she's having some challenges, but we will hopefully get her in as soon as possible. So you talked about a lot of facts about this Delta variant. Wow, with it being like the common cold or chicken pox, is there even a way to really combat it other than getting vaccinated or wearing a mask? Or we just gotta just stay vigilant on those things?
I think those are the best ways. We know that getting a vaccine is going to keep you alive. So that's a really important reason to get a vaccine. It's going to keep you out of the hospital and keep you alive. And then, to avoid even allowing the virus to continue to circulate among us, that's, why we need to continue to wear a mask. And I think Dr. Anderson-Rhodes could probably tell you that our businesses never shut down.
Yes.
We have been in business taking care of patients. We have invited COVID into our business, and we have not spread COVID around our hospitals because everybody in our hospitals wears a mask. So we know that this is a successful way of preventing the spread of disease, of this particular disease. We know, because we're still here operating 18 months later in businesses that actively invite COVID in.
Absolutely. That is such a fantastic point that Dr. Johnson raises. I just have to say here. We have done so much in our healthcare systems, and I applaud all of the healthcare systems in South Florida for really working together. We've not seen this type of synergy and collaboration in any other time in my now almost 30-year career. So that has been outstanding. We share information and data and best practices. And what we know is exactly what she has said. The science is there that vaccination is the one way that we can most stem what's happening in our societies now as it relates to COVID-19. But wearing masks works. We hardly had a flu season this past year. Between wearing masks and also the physical distancing and the social distancing, we hardly saw the flu at all. And we do know that the flu can actually still kill. It's another one of those very potent viruses that can also mutate, which is why every year we should be getting our flu shots. And every year it's a different concoction of the types of materials that are in there, of the most prevalent kinds of flu from the season before. So we know that these mechanisms work. The science is there, and we're really hopeful that through programs like this one and advocacy groups that we'll really be able to see an uptick in the amount of persons in our communities who are getting vaccinated, and those who also follow the CDC guidelines of wearing masks, hand washing, practicing good personal hygiene, as well as cleaning surfaces around, especially if you're having to go back to work and those types of things. And again, practicing that social distancing.
Absolutely. Now, Florida now has other variants on the rise. There's Lambda, there's the new Colombian variant, and others. I typically like to watch what happens in the foreign and European markets because I know we saw Delta variant devastate India, for example, before it had even made an impact here in the US. So in watching those other markets and seeing these different additional variants on the rise now, how are healthcare systems bracing for the potential impact of these developing variants?
Yeah, as I mentioned before, we are trying to encourage vaccination as much as possible because that's what impacts us. It may not, our current vaccines may not protect from infection from all of these different variants, as we're finding that there are a small number of people who have been vaccinated who have what we call a breakthrough infection, and they find that they're having congestion or sore throat, and they go and get tested and they test positive. But what impacts us is if you get sick enough to have to come to the hospital. And so vaccines keep you from getting that sick. And right now, we are being overwhelmed again. Last July, we went through, this same thing. I feel like I'm in that movie, Groundhog Day. You just keep living the same time over and over. In July, I looked back because I give a report every day. So July the 5th, I had 8 patients with COVID in my hospital. August 5th, I had 82 patients in my hospital. That's 10 times the number of patients in the hospital. And almost 90%, 85% of those patients are unvaccinated. Of those patients, I have over 20 patients. We have about 22 patients in our ICU. 0 were vaccinated. 0. So the people who are at most risk of dying are completely preventable illnesses because they could have been vaccinated, and we don't have people who were vaccinated in our ICUs. So that's how we impact, that's what our health systems are all trying to do, is really emphasize what can we do to help get that information out there, to reduce that hesitancy, to answer the questions that are keeping people from taking that step of getting the vaccines. Because what we're seeing is that without the vaccine, you're at risk of dying.
I certainly echo that sentiment. And I think, Anne-Marie, one of the important points to raise and to continue to hammer home with your listening audience, as well as with our communities, particularly the African American community, people think it's misinformation related to the vaccine that they can't get COVID. But we've always said that from an efficacy standpoint, meaning effectiveness, the number one thing that we're trying to prevent is the severity of illness that requires hospitalization, intensive care in an ICU, and or death. Those are the major goals. Although we would love that it would be 100% that none of us would get it, that's never what we've said. And so it's really important that we carry the right message, that we're trying to minimize the severity of illness, particularly in the African American community and communities of color, where we have been disproportionately affected with the severity, as well as just general numbers, but also with the severity of the illness. So it's really important for you and others to really hammer home that message. We're trying to prevent people from dying and from having to come to the hospital, because with coming to the hospital, there's so many other things that can then happen once you're in the hospital that really have nothing to do with COVID in and of itself, just the nature of being in a hospital. And so that's an important message for us to carry. So like Dr. Johnson and the Baptist Healthcare System, we at Memorial are encouraging vaccination. We need more people who look like us as well, to say it's okay, we should be doing it, whether it's in our churches, our other places of faith, clubs, our community organizations. We all need to be encouraging people, particularly our communities, to be vaccinated. It is safe, the science is there. And just like Dr. Johnson here in our healthcare system, over 92% of our hospitalized patients are unvaccinated. That's a staggering, astounding number. And similar to what they're seeing, because we shared a CMO's call and we all had an emergency call yesterday, this is around the state of Florida, that largely this is a surge, what we've called the surge of the unvaccinated. And certainly those who are dying are unvaccinated. So we really want to make sure that people understand that, so that there's not regret later. We know that, that's a term that we've now heard about, vaccine regret. And it is rampant right now because people get really, really ill, particularly people who thought they couldn't get ill. We're seeing it also in younger patient populations. More than half, I think the number today is almost 60% are in the 30s to 50s range. So it's not the same that we saw last year, where it was mostly in the elderly, because a lot of our elderly patient populations have gotten vaccinated, thankfully.
Wow, that is very staggering. And, you hear it on the news, but to hear it here firsthand from you ladies that are on the front line in the trenches just makes it so much more real in our community. And thank you, because that takes us into the confusion about the misinformation and people getting the facts. And we had a comment as well from our audience. And if anyone is listening that wishes to ask a question, please leave your question in the comments and we'll definitely try to get to all of them. How do you handle the conflicting messages between healthcare professionals and the governor with the public at large?
Yeah, I think that people need to understand that, if you have abdominal pain or you have chest pain or, you come down with a fever, you don't call your mayor, you don't call your city councilman, you don't call the governor, you call your doctor. So when you're talking about health issues, you should be listening to your doctor. The public officials, they have other issues that they're considering. They have political issues. They have other ends that they are talking about. The doctors are all we're talking about is your health, because we don't ask you who you voted for when you come into the hospital. We don't ask you what your political affiliation is. We ask you what's wrong with you. What are you feeling? What hurts? So if you're looking for information about what's the best thing to do for your health, do what you've always done. Listen to the healthcare experts, and they will tell you what's the right thing. The governor, at least, is suggesting that he wants to make sure that you have a choice. What I would tell you is make the right choice. Make the choice to protect yourself. Make the choice to protect your children. Make the choice to protect your community. So, as Dr. Anderson-Rhodes said, we've got to get vaccinated. But vaccination is going to protect you. If you're not vaccinated now and you get vaccinated today or tomorrow, it's going to take 5 weeks for you to be protected. You need to put your mask on. And if your children are under 12 and they haven't been able to be vaccinated and they're getting ready to go sit in a classroom with a whole lot of people inside, you need to put a mask on. So whether or not and I know we're in Miami-Dade and Broward County, and there's a whole lot of controversy about whether or not it's going to be a parent's choice or it's going to be mandated. I don't care whether it's mandated. It will be your choice. If it is your choice, make the right choice. Put a mask on your child to make sure that they do not get infected, because children are getting sick. And the one thing that people have to understand is this is a new virus. They called it a novel virus. Novel means new. We are learning every day about it. It's changing. We're learning. So what we say today about what's happening, or what we said yesterday about what was happening, kids didn't get it. They don't get sick. That was yesterday.
Yes.
We're learning new things every day. So why don't you do what is going to protect them? So if you find out something tomorrow, you've already protected your child.
Yeah,
absolutely. Can I please piggyback on that?
Absolutely.
We have our word for this week, and in our administrative team, our A team, is fluid, and we've shared that with our leaders, because just as this virus has adapted, we have to adapt. And as Dr. Johnson said, we're learning new things about this virus every day. And so what the public and the community has to recognize is that what they may be considering misinformation is really just changes. As this virus has changed, we've had to adapt, we've had to course correct, we've had to be fluid in our management, because our job is always to take care of our patients and our community. And we do that the best that we can. We've learned along the way that some things work and some things don't work, but we know the things that do work, masks. And so I'm going to again say masks. If you're going to send your child or you're back to work, please take your hand sanitizer with you, because I've been in schools, mentoring there, they don't always have soap along with that water. So send your child with, if they have to go, with correct hand sanitizer that is alcohol based, at least 60%. And then again, have them be very mindful of their surroundings. Send with, if you can, the little wipes that they can wipe things down, because multiple kids are going to be using the same desk, the same books, the same airspace, I call it. And that's unfortunate, but that's going to be the reality, particularly in our community, especially. So we want to make sure that parents know that if they do send their children back and they're not vaccinated, or even if they are, practicing those great habits. And I recommend that parents would model that, or guardians model that in their home. So even though you all are, in your same bubble, still do the same practice of cleaning, washing your hands. If you have someone who's more vulnerable in your household, still consider wearing a mask as well. Those are things that we know that will absolutely help. So I would just encourage the public to also, if you have questions and you think you're getting misinformation, Dr. Johnson said, contact your healthcare provider, please. You can go to any of the major healthcare systems, the websites for all of us. We have up-to-date information. The stuff that was on there yesterday is going to be different probably today and certainly different next week. As we see this steep, Anne-Marie, this steep is even higher than it was last summer. It's exponential, which means that the rate is going so quickly that, it's making everyone's head spins, but it's also meaning that we're having to be very fluid in what we're doing, saying, and seeing.
Absolutely. Well, before we get into there's more questions, but before we get into the questions, Dr. Biggs, are you with us now?
Yes. I'm sorry, I was having technical difficulties, right?
No problem. Welcome.
Thank you. I have been listening though. I was able to hear, just not able to see. So thank you.
Thank you. Well, this week became, so when we booked this show, this conversation was not very personal, but as of Tuesday, this conversation became very personal to me, because unfortunately, and this is my first time sharing this publicly, I tested positive for COVID a couple of days ago. So without getting emotional, I want to say to everyone out there that is hesitant, because I was supposed to have a procedure on Friday, and I was like, okay, after my procedure, I'll get the vaccine. Well, I won't be having a procedure on Friday. So for everyone who is hesitant, what I will tell you, and it's, everyone's decision, of course, what they decide to do. The scariest thing is seeing a text message come in and you open it up and it says that you're positive with COVID. Emotionally, mentally, it has been a lot, so to speak. So, and I'm very careful, and I'm sure there's a lot of people out there that are super, super careful. I've been very careful for a year and a half. And in the most vulnerable moments, where we had a family member pass away and then celebrating another family member's 70th birthday, somewhere in the middle of all of that, in the vulnerability, I somehow came in contact with the virus. So thank God I'm doing okay so far overall. There's definitely some challenges, but I would just say to everyone out there, protect yourself, even in the most vulnerable moments, because I got caught up in the vulnerable moments. You never know. And the hardest thing is the unknown. Every day, there's an unknown. So with that being said, I just wanted to share that as my own little personal testimony, because when we talk about the hesitation and the refusal that we see, particularly in the Black community, what else can we do to get people to mask up, protect themselves, get vaccinated? I mean, I think that, we've had a couple of shows where we've talked about this with other health professionals. Have you seen a surge in the numbers since as far as vaccination numbers since this new wave? Have you seen it increase?
Anne-Marie, first, if I may, first of all, thank you so much for having the courage to share your story. We're going to be praying for you. I do believe in the power of prayer. I mean, medicine is medicine, but I definitely do, and I want to share that with you. But the power of your testimony, sharing to your audience who trusts in you, is what we need more of, because people follow people, wherever you are, people follow people. And it's our people who need to see and hear your story, or the story of one of my recent patients who shared, and it went national, Ms. Cobb, because they're like you, they're like us, and people trust what you're saying, and you're sharing your story of you were hesitant, you were in a family situation celebrating, a homegoing and then a birthday, and this is really how it happens. And because this variant is so contagious and much more powerful than before, it's so much easier. and people are sharing, you know, having these similar stories. So I would say we do need to have more people sharing you. And for those who are courageous enough to do so, it's important because, again, people follow people. So I just want to applaud you for doing that. I also wanted to just share before I forgot, because I might have a moment, is for those who do contract COVID, there are resources that are available. We don't know about them as much in our communities of color, but I urge you to speak to your healthcare provider, find out if you might be a candidate for monoclonal antibody therapy. It's offered everywhere, but we do know that there's data to show that it works for those who have mild to moderate symptoms who might be at risk for more severe illness. And so we're definitely recommending that you would talk to your healthcare provider about monoclonal antibody therapy and where you might be able to receive that if you are eligible. It is time sensitive, so it is based on, you know, when you are diagnosed and your symptoms. So we're urging everyone, should you in the community get a test that comes back positive, please ask your healthcare provider if you are a candidate. So I did want to share those two things because those are real things that we don't hear a lot about probably in our community that I think is important. So even for you to check about monoclonal antibody therapy.
Thank you for sharing it because I had never heard of it. Thank you.
Good.
You know, I do want to add to that. Part of the issue is that really does concern me. And I heard Dr. Johnson's frustration earlier with, you know, with our people going to internet and their neighbors and everyone else instead of coming to the healthcare providers for their information. And, you know, disparity in care is something that I've always monitored, if you will, and to make sure that the care is evenly distributed, anything that I can do about it. So even like the information that was just given about the monoclonal antibodies, what I want to say to our people is this is one time with this vaccine, there is no disparity. It's the same vaccine being given to white, black, blue, purple, no matter race, color. If you're rich or if you're the homeless person, it's the exact same vaccine. This is the first time that we can actually say that we know there is no disparity and that the vaccine that's being given is equal. What I'm concerned about is when somebody gets COVID, and if they are a person of color, there might be disparity in the care that you're given once you're infected. And that's where we can get in trouble. So that's just one more huge reason why we really need to go out and get and protect ourselves. You know, that old saying, an ounce of prevention is worth a pound of cure. So really speak to your healthcare providers and get your information there, not from all the whole host of crazy information that's out there.
No, and I'm glad you said that because I called my primary care and asked for recommendations, and none of that was mentioned. I was prescribed a Z-Pak and told to take some Robitussin for the cough. So that is and if we don't know, we don't know, because I would have never known to ask for that, which I'm going to ask you to put in a private chat so I can drop it in the comments as well for people to know what it is. But that was not mentioned to me at all when I called yesterday. I was prescribed a Z-Pak. So thank you for sharing that information. If there's anything else we should know to ask our healthcare providers, please let us know, because when you get the text message, the only thing it does is send you to the CDC, which doesn't really give you a lot of information other than over-the-counter medicine, or if you have an extreme emergency to go to the hospital. So it's very little information for someone who tests positive to actually know what to do.
Yeah, definitely we should be getting more information out there about the monoclonal antibodies, because there is data to suggest that it prevents severe disease if you get it, as Dr. Anderson-Rhodes mentioned, on a timely basis. So, you know, it needs to be administered within the first 10 days of the onset of your symptoms, and actually the sooner the better. There are a number of facilities that are available for that, although I will have to say it's not easy. it is posing a challenge to many of our health systems and our communities to provide monoclonal antibodies on a timely basis, because it is an infusion, it's an IV medicine. But I think it is a worthwhile thing to pursue. So I would definitely talk with your doctor about it, whether you are a candidate for that, or you can call us after. We'll talk to you about it.
Absolutely. Now let me.
And I would also,
but I would. Sorry, I wanted to piggyback on something that that Carol Biggs was saying about our own community and the hesitancy. And I know one of the big things that always, I hear people throwing out there is, the idea of distrust of the system because of Tuskegee and other experiments that African Americans were involved in without our consent. The idea of Tuskegee was that there were a group of men who were either known to have or given exposure to syphilis, and they were just observed to see, well, what happens to people when they have syphilis and it doesn't get treated. And then when really definitive treatment came out in the middle of this experiment, being penicillin, they were denied the penicillin because they wanted to keep on seeing, so what happens to these people if we don't give them treatment? And so what really pains me is the irony that we're using that study that denied us treatment, denied our men treatment, to justify why we're going to deny ourselves the treatment today. I feel like we're using that study to continue the legacy of that study, which was to deny us treatment. And exactly what Dr. Biggs said is true. We know that the same vaccine that's being offered in our communities is the same vaccine that I can tell you, the people, when this first came out, my phone was blowing up with people who were white and well-educated and, in the know to find out how can they get it. So the same vaccine that people were clamoring for is the one that's being offered to everybody, including us. And, we should not use Tuskegee as the rationale for not getting this vaccine, because we're only continuing that legacy of denial.
Absolutely. Dr. Anderson-Rhodes, you were going to add something?
Well, that was so well said. I just want to drop the mic right there. that was so well said, because it's true. We are denying ourselves. The thought that there are people around the world, and especially people of color, who can't get it, are clamoring for this that we know works. And there's days when across our country we're discarding vaccine. It's shameful. It really is. It's like we've been provided a scientific way, something that works. And so for us to deny it, it's mind-boggling to many of us. And so I'm hopeful and prayerful that more shows like this and advocates who can get out there will really be able to share exactly what Dr. Johnson said. Let's not deny ourselves. We've been denied for so long. We want to break that cycle. We don't want to accept that, particularly in medicine.
Now, this is a question, and there may be other parents out there that have a similar question. This is a parent who has a child that has severe allergies and is immune compromised. Their pediatrician advised them not to have the flu vaccine for their son because of the allergies and the immune system being compromised. So they want to know what's in the vaccine. Would it be safe for their son in this case? And can the vaccine be, can they receive the vaccine from their physician's office?
So I'll answer the part of the question, what's in the vaccine? So the one vaccine that is available for children from 12 and up is the Pfizer vaccine. And it's what's called an mRNA vaccine. And what that means is that it gives a message to your to the cells in your body to produce the antibodies to this virus. It does not introduce virus. So kind of our traditional vaccines, and this is a new platform, that our traditional vaccines introduced a little bit of either dead or inactivated live virus so that your body would produce the antibody to it, but the virus that was introduced to you was inactivated in a way that it wouldn't make you sick. This doesn't even introduce any virus. This introduces a message to your cells to create the antibody. So it gives a genetic message. It doesn't enter your DNA. It doesn't affect your DNA. It sends your mitochondrial cells the message to do this. As to your individual child, I would reach out to your caregiver, because from here we don't know all the particulars about your individual child, and that child should be seen and have that discussion. I will tell you that there are probably a small number of people, for whatever reason, cannot get vaccinated, and that's all the more reason that as a community, if you can, you should, because there are people who can't and need to be protected.
And he's 8, by the way. So I don't think there's no vaccine for under 12, right?
Not yet. But and to Dr. Johnson's point is the healthcare providers really should be the ones who are advising specific patients who have specific problems. But one of the things that I would say, because we know that this is a disparity in our communities, if you as a parent aren't getting the information that you need, or you have questions, please reach out to one of the healthcare systems that all, big ones are represented here, whether it's Baptist, Jackson, where I used to work, or Memorial. We have specialists, subspecialists, even in the pediatric areas who can address these things. So a pediatric immunologist or a pediatric infectious disease specialist can also help to guide some of these decisions for those children who are eligible. We do unfortunately have some, as Dr. Johnson mentioned, patients who are unable to receive the vaccines, and that is unfortunate, but it is for their safety. But we've also found, since the studies are now ongoing and we have some of the data, that some of the groups that were previously asked not to get vaccinated are now in those groups that now can and should get vaccinated. So one group being pregnant patients, and I'm an OBGYN by training. Initially, people said, no, they shouldn't get vaccinated. Then it was the college said, well, maybe, and just offer it. But just last week, the college said, absolutely, pregnant women should get the COVID vaccine. So those are the types of rapid changes that we're seeing over the course of learning about this disease. There are also some in the immunocompromised realm that are now actually able to get vaccinated, but under the care of their physician, because you want to monitor certain things a little bit more closely in patients. So we also offer those types of sort of consultative services at all of the major facilities here in South Florida. So we're really, really excited again to be able to collaborate with our sister and brother healthcare facilities.
Awesome. Well, thank you. The person with the question said, thank you. They almost lost their son to COVID, and he's just 8. So thank you for that information.
Now, if I may, can I comment on that? Because I think that's a point. I want to thank that listener for sharing that. We are seeing, as I mentioned earlier, younger and younger patients, but even in the pediatric population, in our children's hospitals and our pediatric units, we are seeing otherwise healthy kids now sick enough to be admitted to the hospital. That is different than what we saw last summer. And it gives you that sense that this variant is for real, it's serious, and we all need to take care. Also, because kids, some kids can transmit it silently, right? They're super spreaders, but then you have these buckets of kids who are really rapidly getting sick. And we're going to learn more as this continues, because we're now just seeing this probably here in South Florida in the last 1 to 3 weeks, I would say, where we've had this rapid escalation in children. So really, really scary, but we want to make sure that everybody knows that we're here for our pediatric patients as well. But again, wearing the masks when they can, we can't say it enough, right, Dr. Johnson? Hand washing, and really trying to get back to our bubbles And really trying to practice that physical distancing is so important because they obviously less than 12 are not eligible yet for vaccinations.
Wow. Now, this one is a question from our audience. The rumors about the vaccine and its impact on fertility or pregnancy, and I will admit, since I'm being so transparent today, that was one of my hesitations, was the whole fertility rumor. And for those of us who, women who have some fertility challenges and are looking to get pregnant within the next short period of time, whatever period of time that is, how does the vaccine impact, if at all, women who may have fertility challenges or who don't want to develop any fertility challenges because they're trying to get pregnant, or those who are already pregnant?
So I would say related to pregnancy, and I shared that earlier, we don't have any literature data currently to suggest that it affects someone who's already pregnant. But we know that if you're pregnant and you get COVID, you know, you can certainly have a horrible, horrible outcome. And early on, we weren't seeing as much of the devastation in pregnant women who had COVID, but that's a completely different picture from what it is today. We are unfortunately seeing really sick, pregnant women who have contracted COVID. And again, as Dr. Johnson and Dr. Biggs have said, it's largely preventable. And so it's very sad for us to take care of those patients, some of whom lose their children in the process, their unborn children in the process, and some of them who lose their lives. So I just want us to put it in context, because getting COVID can give people the same things that they're so fearful about, but can also end their lives. And so we have to think about the choices that we're making. I think Dr. Johnson said it so well earlier. If you contract COVID and you get it severe enough, you know, to be in our hospital, to be in our intensive care unit, to be on a ventilator, you know, think about that. You're like the 100%, you know, where there's a bad outcome, you know? So you have to think about that. The chances, or what we know of the science right now, are very small in terms of the fertility issues. I never say never, right? Because we also have a body of the population, you know, that, you know, 30% plus have unknown reasons why they're infertile in the first place. So how it's going to impact, we're not going to know. We're not going to know right away. It's an odds game, you know, and you're playing with your life. Should you get COVID and get it severe enough? And I think that's what I would want to make sure that people understand. And I'm not trying to be, you know, crass or insensitive about it, but that's just the reality of my world and Dr. Biggs and Dr. Johnson in terms of what we're seeing. So we want to be really honest about that. I do think too that patients need to have these real honest conversations with their healthcare providers. And if you're with a healthcare provider that's not culturally sensitive or competent to answer your questions like what we're talking about today, and talk about the risks and the benefits and the pros and the cons, and really talk about real life, what we're seeing, which is death as the ultimate end, then you might need to think about getting a different physician, going to a different healthcare provider, one who is culturally competent and culturally sensitive. And that cultural sensitivity is not a color issue. That's a, do you see me and what my issues are? Are you addressing what I'm concerned about and my needs? That may mean we get to a decision that isn't what we want, but at least we've had that conversation. We can begin the conversation so that people are educated and can make real live choices that matter.
Yeah,
Absolutely.
I'll just add regarding that. Here, there were a lot of hesitancy around our young staff members, and a few of the OBGYN, neonatologists, and all the specialists actually did a lunch and learn, if you will, for the staff, and they did address that, and they looked at you know, the studies that show some of the women who were in the studies to develop this vaccine has since, you know, become pregnant and have had babies, and they've had no issues. So you know, they looked to that and said, well, so far there's been no issues with women who have had the vaccine, and you know, have had healthy babies and healthy pregnancies. However, we have had issues with women who have become pregnant unvaccinated, and unfortunately they themselves had died, or they have lost the baby. The baby was born stillborn. So, I mean, again, everything is risk benefit and weighing, and speaking again to your culturally competent healthcare provider about your personal needs.
Absolutely.
Yeah,
Dr.
so
Johnson?
something that both doctors spoke to, that, talking about, weighing the risks and benefits. And, in the beginning of this, I absolutely understood how certain young people came to a different conclusion about getting the vaccine versus older people. Like, I had no question. I got vaccinated the very first day that I could possibly have been vaccinated. I'm 62 years old, and, I knew what my risks were. I wasn't not having any more children, and, so there was no thought. There was no, I didn't have to think this long and hard. But I understood how young people, because they were looking and saying, well, most of us, if we get the virus, we're going to do okay.
Yeah.
And I don't know what the long-term effects of the vaccine are. But one of the things that I had to remind people is, you don't know what the long-term effects of COVID are either. So yeah, you might know that you're going to survive it, or you might think, and trust me, that calculus has changed now. Because with the Delta variant, as we have mentioned, we have people in our hospitals in their 20s, 30s, 40s. I have, 25% of the people in my ICU are 45 and under right now. So, the calculus has changed. But even if you, want to think to survive it, as you're weighing that, you need to consider that you don't know what the long-term side effects. And, we mentioned chickenpox. So, now we give our kids, without even thinking about it, a vaccine so that they don't get chickenpox. But those of us who did get chickenpox are now looking for the vaccine to prevent shingles. Because, 30, 40, 50 years after you had chickenpox, you get this really painful, horrible rash that can have, side effects beyond just the rash, have complications beyond just the painful rash. But anybody who's had shingles would tell you they would have, definitely taken anything to, avoid that pain. And that is a consequence of having had chickenpox, which wasn't even that, severe of a viral infection in the first place. So, you don't know what are the consequences in the long term of getting COVID. So as you're weighing what you don't know, make sure you include all the things that you don't know.
Wow.
Absolutely.
Absolutely.
COVID long haul, by the way.
Yes, let's talk about that.
COVID long haul. And so to Dr. Johnson's point, we're seeing patients who have continued respiratory issues, the heart issues. Some people are afraid to get the vaccine because might affect my heart. Well, that is such a small percentage, but we now see that there are some heart abnormalities for people who've had COVID who are in this long haulers group. And so we're going to definitely see, so as we go further out, some of these extra signs and symptoms, and fertility might be one of those that's affected for those who might have had COVID. We don't know. And so I like her analogy in terms of what not only the risk benefit for now, but what it's going to look like in the future.
Yeah, I think a good friend of mine said to me yesterday, who had been telling me for months to get a vaccine, it's like, well, you got to protect yourself today in order to even be around for your future child. So,
Exactly.
So here we are. In your opinion, what mandates should be in place to stop the spread? We know that some of our political folks are opposed to mandates. We see that some municipalities are going back to mass mandates. But then we also see, like in the state of New York, or New York City particularly, where the mayor there has mandated proof of vaccination to go into gyms or restaurants or a lot of different facilities. So in your opinion, do you think that these mandates should be put in place to stop the spread, or to get people to get vaccinated?
I think there definitely should be some advantages to having, been vaccinated. So, I definitely favor the fact that if you have been vaccinated, we know you're at lower risk for transmitting it, then there should be some benefit that accrues with that. I think that regardless of what happens with whether or not municipalities are able to put in mandates, that again, people make make the right choice to protect themselves. So whether or not we are allowed to put in a mask mandate, I think people should do the right thing to protect themselves and to protect their loved ones and to protect our community from allowing this virus to continue to spread and change, to do the right things and do the mitigation that we know works during the surge. So right now we're in a surge. The CDC said if you live in an area that's in a middle of a surge, you need to wear a mask when you're inside and or in tight areas, with a lot of people. We're in a surge, and if nothing else, I think I can speak for the three of us to say that if you care about the health of your hospitals, you'll do what needs to be done to lower this surge, to stop that curve, to bend that curve, because we're getting to a point where we're not going to be able to take care of people who don't have COVID as well as we normally do. We'll be there. We're going to be there. I can tell you, if I learned one thing about my colleagues in healthcare, is that we stepped up to the plate, we lived up to that oath, and we put ourselves and our families in jeopardy for our community. And I have never been more proud to be, a member of the healthcare team as I have been over this past 18 months. So we're going to be there, but it's going to be a struggle. And if we keep going at the rate that we're going now, we are not going to be able to do the job to the best of our ability.
Well said, Dr. Johnson. Again, that's another drop the mic. Only thing I will add to Dr. Johnson's point, as our hospital become over capacity, it's not just about COVID anymore. We're talking about the regular stroke patients, heart attack, and what have you, who their care will be delayed just because if an ambulance have to bypass one hospital to go to another just because that one does not have capacity, think about the potential harm for that family member. It could be yours. So I hear people saying, it's my right to do this. It's a personal choice. It's not so personal when you can be infected and infect others and affect others how their care is provided. Again, kids under 12 cannot be vaccinated yet, right? So what about them? Who's protecting them if the adults aren't protecting themselves? So we really have to look at this, that we are our brother's keeper in this instance, and we all have to do our part to play our part in this community in which we live.
And I think I would just add that, mandate is such a strong word, and I do prefer as well that people would choose to do the right thing. I got vaccinated at 55 because as soon as I was able to, the first day I was running to get it, because I have an elderly mom who has dementia, who my twin sister and I have shared, who unfortunately got COVID from her caregiver. And was hospitalized for a month, and only by the grace of God she's with us. But I do it for her. I do it for my children. I do it for my neighbors. I do it for my community. So I'm really prayerful that, and I want to be encouraged as well, that our communities will do it and do the right thing for the right reasons without a mandate. That said, I'm not opposed to personally a mandate. We have flu vaccination mandates currently almost across all of South Florida, where it's mandatory flu in certain healthcare environments. And there is in those situations sometimes a credit, for getting that. I recognize that the current vaccinations for COVID are under still emergency use authorization, but I'm really ecstatic that as of, I think it was yesterday, there was the announcement that we're hopeful that in the next month, by September, that it will be fully FDA approved, which I think hopefully will cause another big boost of persons to get vaccinated. So I'm really hopeful that that will come to fruition. I do also want to just say that having mandates, just like having COVID, is not political, in my view. It is a matter of what reality is. And we're in a real live situation that people need to understand it's a crisis. So the care and concern and compassion that we as healthcare givers, as our healthcare systems have poured out over the last 18 months, we ask and implore you, the community, to have that same care, concern, and compassion for us and consider vaccination. And if you can't or won't, to please follow the very important guidelines that we have laid out throughout this program. You don't just do it for yourself, we do it for everyone. And we're hopeful that the listening audience and our communities will jump on board to that message.
Absolutely. Well, thank you so much. I just want to show this for a little lighter comment. Remind the guys that take the little blue pills, some of them are made by Pfizer.
Absolutely.
That's a good one.
And none of them were asked about the long-term side effects of that, were they?
And what's interesting, no one asked what's in it, right?
Nobody
Just give it to me.
The blue pill.
Love it.
Well, ladies, this has been an amazing session. Thank you so much for all of the knowledge that you have imparted on us, myself personally, as well as everyone who is listening. We have a lot of great comments. A lot of people really tuned in and appreciate the information that you've shared. Just on another last note, is how your individual organizations and just getting information. Where should people go for information or to get in touch with you or your organization?
Well, definitely you can go to the Jackson Health System website. We have a lot of information and videos there, different videos that we have done over the last 18 months, as well as there is contact information that you can contact us. And we, and I'm sure I'm speaking for my all the panels here, we will answer any questions and speak to anybody who contact us who have a question. And we will even tell you where to go to get the vaccine. So please do reach out to us. Thank you.
I concur. So Memorial Healthcare System, MHS.net, has on our website or internet page, plethora of information, as well as the contact information, which I think is so important. And, anyone who contacts us, we are more than happy, willing, and able to direct everyone in every community in South Florida. And if it's not Memorial, we will send to Jackson Baptist, wherever we can get people to get the correct information as well as to get the vaccine. And my last comment would be, please pray for us. We're asking the listening audience. We are in a crisis situation. We are definitely in a surge. We are stretched. And we're going to continue to do what we've always done, all three health systems. I am sure of that, but we do ask for the community to please keep us in your prayers.
Absolutely. Dr. Johnson?
Yeah, so baptisthealth.net, you can go on our website as well. We also have care on demand that for at least the next month, I believe, is without charge with the code CARE19. That is the portal of entry for people who may need monoclonal antibodies. They can get scheduled. It's not a fast process necessarily, but that is at least the portal of entry. So they can reach out through that. So it's Care on Demand is a virtual service, but this month it's free.
Excellent.
Thank you, ladies, so much. Well, please stay with me. I have a few announcements to make, and thank you everyone who's tuned in. Let's continue to be vigilant. Thank you for your warm regards and your thoughts and prayers for me. I will be staying strong and battling through this COVID. So continue to keep me in your prayers, and I thank you all for all your warm comments and prayers for me. We have a few announcements. And I want to thank our sponsors again, Broward Health, AARP, the Solid Waste Authority of Palm Beach County, the African American Black Alzheimer's Disease Initiative at the John P. Husband Institute for Human Genomics, University of Miami School of Medicine. Please be sure to check out our current issue of Top Educators of South Florida and save the date. August 22nd, we will be releasing our 40 under 40 issue with our Black leaders of today and tomorrow. It'll be available in the Miami Herald and the Sun Sentinel, as well as on miamediagrp.com. And be sure to remember to tune into our show Soul, hosted by Nikki Jellin, every Wednesday evening at 7 p.m. as we disseminate intellectual entertainment on fashion, arts and culture, relationships, mental health, and food in South Florida. Be sure, as always, to please share this video, because especially today where we have so much great information, please share across your networks, and save the date and mark your calendar. And we'll see you back here next Thursday at noon. Thank you.
Okay, bye.
Thank you.